I'm Ms. Valek, and today I'm going to walk you through a physical head-to-toe shift assessment. Before I do the video, I want to just walk you through the things I'm assessing as I'm going through the physical assessment so you'll know what you're looking for. The first thing before I even come in the room is I want to have reviewed the chart to make sure I know what the diagnosis is, if the patient is a DNR or not, what their status is, their diagnosis, what their vital signs are. It's very important that I check that before I come in the room so that I have a baseline. I also need to make sure that the vital signs were recently done, since that is part of my physical assessment. And then when I come in the room, I remember to do my beginning things, which includes washing my hands, asking the patient their 2 identifier questions, and introducing myself as well. I want to make sure that I do good body mechanics, that I raise the bed up to a working height. You always want to remember to do that. Raise your bed up like that. Okay, and then we're going to also, if we need to, raise the head of the bed up also. It's really important when I come in the room that I remember that I'm assessing this patient as soon as I walk in the room. Because remember, we talked about visual inspection. So as soon as I walk in the room and I start talking to this patient, I'm already assessing. I'm assessing their level of consciousness. I'm assessing them to find out if they are, if their affect is good or not. If they're in pain, I can see that. I can see their skin color. I can see their mobility status. There's a lot of things I can see just when I walk in the room. Also, I want to make sure that as a nurse, I'm very detailed in everything I look at, very observant. So as I look around the room, I want to see, what equipment do I have? Do I have any oxygen on the patient? Do I have any IVs on the patient? Is there a Foley catheter? Those kind of things. If there is, part of my assessment is making sure those things are hooked up and that they are running like they're supposed to be. Then once I've done my beginning things and I've assessed the patient's 2 identifiers, introduced myself, washed my hands, then I can go ahead and start my head-to-toe assessment. It's very important that you interact with the patient and you talk to the patient to let them know what you're going to do. When I start my assessment, I always want to do head to toe, okay? So as I go through my assessment, I'm going to start with the head. I'm just really looking to see if I see any problems with their head. Is there any bruises or any problems with their hair? Do I see problems with that? Look at their skin on their face. Do I see any problems there? Okay. And as I'm going through, I'm assessing skin constantly, by the way. And also I'm always talking to the patient. So I'm going to take my pen light and I'm going to look at the eyes for pupil constriction on each side. And remember to turn the light off when you check for pupil constriction. Then you're also assessing for accommodation. So when you do the accommodation and you do the constriction, then you can say PERLA, pupils equal, round, reactive to light, and accommodation. Okay, that's what that stands for. So when I do the accommodation, I want the lights on. Okay, so when I do that, I'm just taking my pen light, I'm going straight down and asking them to watch the pen light, and I should see their eyes turn inward to watch the pen or the pen light as I'm going in, and their eyes should constrict, their pupils should constrict as that pen light's coming in. Okay, then I'm going to take my pen light and I'm going to just ask them to turn their head. I'm going to just briefly look inside each ear on each side, and you can stay on this side to do this, okay? So I'm just looking in each ear, okay, because most patients can turn their head all the way over for you, so you don't have to go side to side. I'm going to look inside their nose on each side, each nostril, to see if I see any polyps or any redness, any problems there. I'm going to go ahead and ask them to say ah, open their mouth, and I'm going to take my pen light and I'm just going to look inside there for the same reason. I'm assessing their teeth, I'm assessing their tongue and their mouth to make sure that there's not any obvious bruises or any bumps or any sores inside their mouth, okay? Then as I come down, I'm just doing a visual inspection of the neck. I'm looking at those pulses. Remember the carotid pulse? I'm looking there to make sure I don't see a bounding pulse. I don't have to assess that pulse. I'm just looking to see, do I see a bounding pulse there? Okay, as I come down, remember to remove the gown and provide privacy when you're doing this, because you've got to listen with your stethoscopes on the skin. Okay, so you're gonna hear the best sounds when you do that. You don't wanna listen on top of the gown. Okay, remember, you have to listen to all lung fields. Okay, so you're gonna start right up here, right a little bit below the clavicle, on each side, and you're gonna go side to side. Each time you move your stethoscope, you're gonna make sure they take a big deep breath, listen for the full inspiration, and listen for the full expiration, okay? You just keep going side to side, okay? And as you go down, you make sure that you're gonna start going out to the axillary area down here. So over here, you wanna listen on the axillary area here and over here. Okay, so there's a lot of different points you've gotta listen to for your lungs. Okay, now it's a good idea to keep your body systems together. Okay, so you've listened to the front, so you've listened to anterior, you've listened to both sides, so that's bilateral, okay, and you've listened to all lung fields. So now I wanna compare, especially if I've got adventitious lung sounds, I wanna compare that to posterior. So at this point, you wanna ask the patient to sit up or get someone to help you raise the patient. For our purposes here in the lab, they're kind of heavy, so we will help you, or someone will help you raise this patient up, okay? So if you can see on the back, and we'll just get the camera to move over here so you can kind of see where I'm going here, okay? So on the back, you're gonna be closer to the spine, okay? So you're gonna do points like here, 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 and you are listening for a full inspiration and expiration. And as you come down, go ahead and start going out to the side so you can get the axillary areas. You're probably only gonna come down to about right here for your lung sounds. You're not gonna hear anything really below that because your lungs really don't go down past that. You are also doing a skin inspection. When I pull the patient up on the sitting up, I'm looking at the back for any bed sores, skin breakdown of any kind, so it's a good time to do that. And also the skin color. Okay, we're gonna ask the patient to lay back down. So now I've assessed anterior and posterior lung sounds, okay? Now I can take my stethoscope and I can listen to the apical pulse. So the apical pulse, again, we want you to be able to recite the landmark, which is the 5th intercostal space, left midclavicular line. So we want to go below the clavicle, in the spaces, and go down 5 spaces. For women, remember, you're gonna probably have to lift their breast up to be able to listen underneath that, because it's gonna kind of be in that area. If you have to lift breasts up, in that case, you probably do want to put gloves on, okay? Otherwise, if you don't have skin abrasions or problems, there's no reason to wear gloves for just a routine physical assessment, okay? So you would listen to the apical, we'll say it's about right here. For 1 full minute, you're going to have to count on your watch for 1 full minute, okay? So once you listen to the apical pulse, then you're gonna put the gown back on. Always cover your patient back up because they do get cold really easy, okay? And we don't need this blood pressure cuff on anymore. When you're assessing the arms, remember, you're gonna come down here and you're going to get them to raise their arm up. You're also assessing range of motion, okay? When you ask them to raise their arm up, you're assessing range of motion. So you can tell how much range of motion, how much mobility that they have in their arm, okay? Do a very thorough skin assessment. Look at their skin very well. You have to pull the gown down for all parts to look at every part of their skin, okay? Okay, then you're gonna do the same thing on this arm. And again, if the patient has good mobility, you can just get them to raise their arm up and stay on this side, okay? And you're gonna just be looking at all skin areas. You may have to ask them to turn over a little bit. All skin areas on all parts, okay? And while you're here at the arms, you're gonna go ahead and you're gonna assess their radial pulses. Now you know that the radial pulse has already been taken because you took vital signs. This is just checking to make sure they're equal. That's all you're doing on this part. So you can just do right like this, check and make sure. You don't have to count it for any amount of time. You're just making sure that they feel equal and that they're regular, okay? You can go ahead now and you can check for capillary refill, which should be less than 2 seconds. You can assess their thumb, or you can assess one finger, but only one on each hand. And so I'm gonna assess that and make sure it does, the blood does come back within less than 2 seconds, okay? You can also do the other side from right here. Same thing over here, okay? All right, now, a good thing to do to make sure that they have good strength is get their hands and ask them to grasp your hands. Okay, so they will do that. Some of them are pretty strong, but some of them are weaker, okay? Now, while you're here, you can go ahead and do skin turgor to assess for tinting. So you can do it right here on the chest, okay? And you want it to have good recoil and return back to place. If it doesn't and you have tinting, that could mean dehydration, okay? As you come down, remember, you're also gonna provide privacy as much as you can this whole time, because I'm gonna assess the abdomen now. So I'm gonna go ahead and make sure I have this patient well covered, and I'm gonna ask the questions, okay? Because remember, I gotta do assessment in all areas. So I'm gonna assess things like, when did you eat last? How's your appetite? Did you have a bowel movement today? When was your last bowel movement? Are you urinating okay? Okay, do you have any problems with your bowel movements? Those are good questions to ask, because just hearing sounds is not enough. You got to be able to assess what the patient's symptoms are. Then remember, you listen, starting, as ATI tells you, you should start in the right lower quadrant, and then you just go from each quadrant and you listen for bowel sounds. As soon as you hear the sounds, you know they're active in that quadrant. If you have to listen for a long time, when you get between 3 to 5 minutes of listening, some books say 2 minutes, they're considered absent, okay? In that case, you should get another nurse to come listen before you just go call the doctor and say, these bowel sounds are absent. It's always a good idea, especially as a new nurse, you should do that. As part of your routine shift assessment, you do not have to assess the perineal area. However, if there's a catheter there, you do want to make sure that you do look at the catheter to make sure that there's no signs of infection or any problems. But making sure they're voiding okay, there's no burning, there's no pain, there's no hesitancy or urgency that's involved when they urinate, that tells you that there's no problems with their urination in their bladder, okay? Now, you might see at this point that this patient is soiled, and so you would want to, as soon as you get done with your assessment, have someone come and clean this patient up, okay? Then as you go down the feet, you're looking at the legs. You will want to keep the patient covered, and if this patient's a very cold-natured patient, you could always get like what's called a bath blanket or another blanket and just like fold it over the top here so that will keep them warm and provide privacy. It just makes them feel a lot more secure when you do that. As you go down to the feet, I'm gonna check range of motion in the legs. I'm gonna ask them to raise their leg up, see what kind of range of motion they have. I'm gonna assess their skin really well, okay? Make sure I don't see any skin breakdown anywhere, and hopefully they're raising their leg for you, okay? And then you do the same thing on this side. Make sure that you don't see any, you gotta kind of move the gown around to make sure you don't see any kind of skin abrasions or any skin problems, especially in the points where they're most common to have skin breakdowns. So like on their heels, their hips, you want to make sure you don't see anything. So literally pick up the foot and look at the heel area to make sure you don't see anything there, especially on your bedridden patients. So then after you do the skin assessment, then just come down here and do your pedal pulse, okay? I personally do them one at a time just because pedal pulses can be hard to palpate. So do them one at a time, and some of these older people, it's hard to feel their pedal pulses. You might need to get help from your instructor or somebody else to be able to feel them, especially when you're first learning. Make sure that you do feel pulses in both. You're not counting this pulse. This is just making sure the pulse is present, okay? And then you're looking at their toes. Again, I'm assessing for their skin color. And I just do capillary refill in one toe, and same thing on the other side. Now, in the long-term care facility, you might have to remove 5 pairs of socks to get to their feet. And that's just because they're cold-natured anyway. So you do want to make sure that you cover this patient up as quick as possible when you're done. So then when you get finished with that part, you want to come to the bottom of the bed, and you're going to assess for strength in their feet, okay? And you just tell them to press against your feet, okay? And that will tell you that they have good strength there, okay? Now the very last thing you want to do, and really my bed should be a lot higher than that, but I'm just like going through the motions with you here. The very last thing you want to do is you do want to turn this patient from side to side to double check the points that you may not have been able to see as you were going through the assessment. Okay, so you're gonna turn this patient, hopefully again, the patient can turn on their own and you're not having to like literally, if you literally have to do this, you're gonna wanna use your draw sheet, have your bed up high enough. You're gonna want to make sure you have another person in there to help you. Okay, so you'd wanna go do this, turn the patient aside, and you wanna really do a good inspection, like move the gown. Really do a good inspection all the way down. This is a point where they can get pressure ulcers right in here, all the way down. Okay? And make sure they're not wet, because the wet, soiled areas can cause more of a risk for the pressure ulcers also. Okay? Same thing over here, and you can just take the patient here, use the draw sheet, have them move this way, okay, and do the same thing. Double check all the way down. And make sure you don't see any skin problems, okay? When I came in the room, I will also, you'll see on the video when I do the skill, I will ask them to give me a pain scale, if they're having any pain or not. And then I will try to get them some pain medicine if it's ordered, and take care of that. Now, some patients will want pain medicine as soon as you walk in the room. So remember, you don't want to give pain medicine or do anything that's an intervention until you actually do your assessment, okay? So you want to do a quick assessment. Quickly, I just want to say, if this is a quick focused assessment, and this patient, say this patient has a wound, you would just literally come in. You wouldn't do all those head to toe things. You would just, at some point during the shift, you've got to come do a head to toe assessment, because that's a standard. But you would just come in the room, you would make sure your vital signs are done. Vital signs are vital, so you wanna make sure that you've done the vital signs. And you would literally always, in every focus assessment, listen to heart and lungs and bowel sounds, okay? Do those things. And then you want to go look at the wound, okay? That's gonna be more of a quick focused assessment you can do if you're trying to just make sure you check the wound or whatever it is that the patient is having a problem with. So that's all on this video, and in the next video we will go over the actual skill.